What if your kidneys were failing quietly, but your body had already been warning you for months? Not with sharp pain, not with a loud emergency, not with something dramatic, but with small signs: tiredness, swollen ankles, foamy urine, itchy skin, nighttime urination, muscle cramps, shortness of breath, a strange taste in your mouth, blood pressure that keeps rising. Most people miss these signs because they look ordinary. They blame age, they blame stress, they blame poor sleep, they blame the weather, they blame getting older. But sometimes, what looks like normal aging is actually your kidneys asking for help. Today, I am going to show you 9 silent warning signs your kidneys may be in trouble, and the important tests doctors use to catch kidney problems early before they become severe. But before I show you the first sign, let me tell you a story from Columbus, Ohio. A man I will call Robert Hayes was 68 years old. Robert was the kind of man who always said, "I'm fine." He had worked hard his whole life. He loved black coffee, salty food, grilled meat, and watching football on Sunday afternoons. He had 2 grown children, 3 grandchildren, and a wife who kept telling him to go to the doctor more often. Robert had high blood pressure for years. His doctor once said his blood sugar was getting close to diabetes. He had gained weight around his belly. He took over-the-counter pain pills for back pain more often than he admitted. But Robert did not think of himself as sick. He still drove. He still worked in his yard. He still carried groceries. He still laughed with his grandchildren. So when the first warning signs appeared, he ignored them. At first, he was just tired. Not tired after hard work. Tired all the time. He would wake up after 7 hours of sleep and still feel heavy. Then his shoes began feeling tight by evening. His wife noticed his face looked puffy in the morning. He started getting up 2 or 3 times at night to urinate. Sometimes his urine looked foamy. Sometimes food did not taste right. Sometimes he felt short of breath climbing stairs. His skin became dry and itchy. His legs cramped at night. But every time something happened, Robert had an excuse. "I'm just getting older. I ate too much salt. I didn't sleep well. My back pain pills are fine. They sell them at the store. I'll talk to the doctor next time." But next time kept moving farther away. Then one morning, Robert bent down to tie his shoes and felt unusually breathless. Not after running, not after exercise, just from bending down. That scared him. Later that day, his daughter took him to a pharmacy to check his blood pressure. The number was much higher than normal. His daughter said, "Dad, this is not something to ignore." A few days later, Robert saw his doctor. The tests changed everything. His creatinine was high, his eGFR had dropped, his urine showed protein, his blood pressure was damaging his kidneys, his blood sugar was no longer just a small warning. And for the first time, Robert heard words he never expected. "Your kidneys have been struggling for a while." Not complete failure that day, not dialysis that day, but serious warning signs. The frightening part was this: his body had been speaking to him for months. He just did not understand the language. That is why this video matters. Kidney disease can be quiet, it can be slow, it can hide behind symptoms people think are normal. And by the time many people feel truly sick, kidney damage may already be advanced. I am Dr. Adrian, and today I want to help you understand the signs your kidneys may be sending you. But listen carefully. No single symptom proves kidney failure, and no test can guarantee you will avoid dialysis. But early testing can help detect kidney problems sooner. And early detection gives you and your doctor a better chance to slow the damage, treat the cause, protect your remaining kidney function, and reduce the risk of severe complications. This video is not about panic. It is about awareness. Because your kidneys do much more than make urine. They filter waste from your blood. They remove extra fluid. They help balance sodium, potassium, and other minerals. They help control blood pressure. They support red blood cell production. They help maintain bone health. And when they start failing, the whole body can feel it. So stay until the end, because after the 9 warning signs, I will show you the key tests you should ask your doctor about. Those tests may reveal kidney damage before symptoms become dangerous. Now let us begin. Warning sign number 9, constant fatigue. Many people think tiredness is just part of getting older, but constant fatigue is not something you should automatically accept. When the kidneys do not filter well, waste products can build up in the blood that can make the body feel heavy, weak, and drained. Kidney disease can also contribute to anemia. Anemia means your body does not have enough healthy red blood cells to carry oxygen properly. Less oxygen means less energy. This is why some people with kidney problems feel exhausted even after sleep. They wake up tired. They feel weak after simple tasks. They lose interest in walking, cooking, cleaning, or socializing. They sit more. They move less. Then weakness gets worse. And because it happens slowly, they do not realize their life is shrinking. Now, fatigue alone does not mean kidney failure. Fatigue can come from sleep apnea, heart disease, thyroid problems, depression, low vitamin B12, anemia from other causes, infections, medications, poor diet, or stress. But if fatigue comes with swelling, foamy urine, itching, nausea, shortness of breath, or high blood pressure, you should not ignore your kidneys. The question is not, am I tired? The better question is, why am I tired every day? Warning sign number 8, swelling in your ankles, feet, hands, or face. This is one of the most visible warning signs, but people still miss it. They say, my socks are just tight. My shoes are old. My rings feel small today. My face is puffy because I slept badly. But swelling can be your body's way of saying fluid balance is not right. Healthy kidneys help remove extra sodium and water. When kidney function declines, fluid can build up in the body. That fluid may show up in the ankles, feet, lower legs, hands, or around the eyes. Some people notice swelling at night. Some notice puffiness in the morning. Some gain 2 or 3 pounds quickly and think it is fat. But fat does not appear overnight. Fluid can. Now, swelling does not always mean kidney disease. It can come from heart failure, liver disease, vein problems, medication side effects, too much salt, sitting too long, or standing too long. But regular swelling should be taken seriously, especially if it comes with high blood pressure, shortness of breath, foamy urine, or reduced urination. Robert missed this sign. His shoes became tight. His socks left deep marks. His face looked puffy, but he kept blaming salt and age. And yes, salt can contribute. But the deeper question is this. Why is your body not handling salt and fluid well anymore? That is where kidney testing becomes important. Warning sign number 7. Urinating more often at night or urinating much less than usual. Your urination pattern can tell you a lot. Some people begin waking up several times at night to urinate. Others notice they are urinating less than usual. Some notice the stream changes. Some notice urgency. Some notice cloudy urine. Some notice darker urine. The kidneys are closely connected to urine production, so major changes deserve attention. Now, nighttime urination can have many causes: enlarged prostate, diabetes, bladder problems, sleep apnea, heart failure, certain medications, drinking too much fluid late at night. But kidney disease can also affect urine patterns. If you are waking up 3 or 4 times every night, do not just laugh and say, that's age. Your sleep matters. Your blood sugar matters. Your prostate matters. Your bladder matters. Your kidneys matter. And if you are urinating much less than usual, especially with swelling, fatigue, or shortness of breath, that is even more concerning. Urine is one of your body's clearest messages. Do not ignore changes that repeat. Warning sign number 6, foamy urine. This is one of the most important signs on the list. Many people see bubbles in the toilet and never think twice. But persistent foamy urine can be a sign of protein in the urine. And protein in the urine matters. Healthy kidneys are supposed to keep important proteins in the bloodstream. When the kidney filters are damaged, protein can leak into the urine. That leakage may create foam. Now, not every bubble means kidney disease. Urine hitting the toilet quickly can create bubbles. Toilet cleaning chemicals can confuse you. Dehydration can change appearance. But if your urine is repeatedly foamy, thick-looking, or bubbly in a way that does not quickly disappear, get it checked. Especially if you also have swelling around the eyes, swollen ankles, diabetes, or high blood pressure. Protein in the urine can be one of the earliest signs that kidney filters are damaged. This is why urine testing is so important. Some people wait for pain, but kidney damage may not cause pain. Sometimes the first warning is in the urine. Warning sign number 5. Muscle cramps, weakness, or restless legs. Muscle cramps can happen for many reasons. Dehydration, overuse, low magnesium, medications, poor circulation, nerve problems. But kidney disease can also affect muscles because the kidneys help balance electrolytes. Electrolytes include minerals such as potassium, calcium, sodium, magnesium, and phosphorus. When kidney function declines, these minerals can become imbalanced. Too much or too little of certain electrolytes can affect muscles, nerves, and even heart rhythm. Some people experience leg cramps at night. Some feel weak. Some feel twitching. Some feel restless legs that make sleep harder. Now, a cramp once in a while is common. But frequent cramps, especially with fatigue, swelling, high blood pressure, itching, or urine changes, should not be dismissed. Do not just drink random electrolyte drinks either. Some electrolyte drinks contain potassium, sodium, sugar, or additives that may be wrong for kidney patients. If kidney disease is possible, do not guess with minerals. Test first. Warning sign number 4. Loss of appetite, nausea, or a metallic taste. This sign is easy to miss because it does not feel like a kidney symptom. People think kidney disease must cause pain in the back or changes in urine, but advanced kidney problems can affect the stomach, mouth, and appetite. When waste products build up in the blood, food may become less appealing. You may feel nauseated, you may feel full quickly, you may lose interest in meals, you may notice a metallic taste, some people describe bad breath or an ammonia-like smell, some say meat tastes strange, some begin losing weight without trying. This is dangerous because when appetite drops, nutrition drops. When nutrition drops, muscle loss increases, weakness increases, the body becomes more fragile. Now, nausea and appetite loss can come from many conditions: digestive problems, medication side effects, liver disease, infection, gallbladder disease, cancer, stress. But if poor appetite comes with fatigue, itching, swelling, or urine changes, kidney health must be considered. Your mouth and stomach may be telling you what your kidneys cannot say directly. Warning sign number 3. Dry, itchy skin. Kidney disease can affect the skin. Many people do not know this. They think dry skin is just weather, soap, or aging. And sometimes it is. But kidney problems can contribute to dry, itchy skin because the kidneys help keep the body's internal chemistry balanced. When waste and mineral balance are disturbed, the skin can become itchy, dry, irritated, or uncomfortable. Some people itch mostly at night, some scratch until they bleed, some cannot sleep because of itching, some develop skin that looks pale, yellowish, darker, or unusually dry. Again, dry or itchy skin does not automatically mean kidney disease. It can come from eczema, allergies, diabetes, dehydration, medication, thyroid problems, or cold weather. But if itching is persistent and appears with fatigue, swelling, poor appetite, or urine changes, you should ask about kidney testing. Your skin can be a mirror of what is happening inside the body. Warning sign number 2. Shortness of breath, confusion, or brain fog. This is where kidney problems can become more serious. If the kidneys cannot remove extra fluid, fluid may build up in the body. In more serious cases, fluid can affect the lungs and make breathing harder. Kidney disease can also contribute to anemia, meaning less oxygen reaches tissues. That can make you feel weak, dizzy, short of breath, or exhausted. Waste buildup can also affect the brain. Some people feel foggy. They cannot concentrate. They forget things. They feel confused. They feel slower mentally. They have trouble making decisions. Now, shortness of breath can be an emergency. It can come from heart problems, lung disease, blood clots, infections, severe anemia, panic attacks, or other serious conditions. If shortness of breath is sudden, severe, or comes with chest pain, blue lips, confusion, or severe swelling, seek urgent medical care. Do not wait. But if breathing slowly becomes harder over weeks or months, and you also have swelling, fatigue, high blood pressure, and urine changes, kidney disease could be part of the picture. Do not ignore it. Warning sign number 1. Blood pressure that keeps rising or becomes hard to control. This may be the most important warning sign. High blood pressure and kidney disease are deeply connected. High blood pressure can damage the kidneys. Damaged kidneys can make blood pressure worse. This creates a dangerous cycle. Pressure damages the tiny kidney blood vessels. The kidneys filter less effectively. Fluid and hormone systems become disturbed. Blood pressure rises further. More damage occurs. And because high blood pressure often has no symptoms, many people do not feel anything while damage is happening. That is why blood pressure is sometimes called a silent killer. If your blood pressure keeps rising, if your medication no longer works as well, if you suddenly need more medication, or if your blood pressure is high and you also have diabetes, you must ask about kidney health. Do not just ask, how do I lower the number? Ask, could my kidneys be involved? Robert did not ask that question early enough. His pressure had been high for years. He thought the danger was only stroke or heart attack. He did not realize his kidneys were also taking the hit. Now you know. Blood pressure is not just a heart number. It is a kidney number too. Now we have covered the 9 warning signs: fatigue, swelling, nighttime urination or reduced urination, foamy urine, muscle cramps, loss of appetite, nausea or metallic taste, dry, itchy skin, shortness of breath or brain fog, blood pressure that keeps rising. But symptoms are not enough. Symptoms raise suspicion. Tests give clarity. So now let us talk about the tests you should know. Test number 1. Serum creatinine. Creatinine is a waste product made by muscles. Healthy kidneys remove it from the blood. When kidney function declines, creatinine can rise. This is one of the most common blood tests doctors use to evaluate kidney function. But creatinine alone is not perfect. A very muscular person may have a different creatinine level than a frail person. Dehydration, illness, medications, and other factors can affect it. That is why creatinine is usually used with the next test. Test number 2. eGFR. eGFR means estimated glomerular filtration rate. This number estimates how well your kidneys are filtering your blood. It is one of the most important kidney numbers you can know. Many people hear, your labs are okay, but they never ask for the actual eGFR. Ask for it, know it, track it over time. One abnormal number may not tell the whole story, but a low eGFR that stays low over time can suggest chronic kidney disease. If you are over 50, especially if you have diabetes, high blood pressure, heart disease, obesity, or family history of kidney disease, knowing your eGFR matters. Test number 3. Urine albumin to creatinine ratio, also called UACR. This test checks whether albumin, a type of protein, is leaking into your urine. This is extremely important because kidney damage can show up as albumin in the urine even before eGFR becomes severely low. In other words, your blood number may look acceptable, but your urine may already be warning you. If you have diabetes or high blood pressure, ask your doctor whether you need a UACR test. Do not rely only on blood tests. Kidney health needs blood and urine testing. Test number 4. Urinalysis. A standard urinalysis can check for protein, blood, signs of infection, glucose, concentration, and other clues. It is simple but powerful. If you have foamy urine, dark urine, blood in the urine, cloudy urine, burning, or major changes in urination, urinalysis may help your doctor understand what is happening. Test number 5. BUN and electrolyte testing. BUN stands for blood urea nitrogen. It is another marker related to waste products in the blood. Doctors may also check sodium, potassium, bicarbonate, calcium, phosphorus, and other values. These matter because kidney disease can disturb mineral and acid balance. High potassium can be dangerous for the heart. Acid buildup can affect muscles and bones. Phosphorus problems can affect bone and blood vessel health. So if kidney disease is suspected, these blood tests matter. Test number 6. Blood pressure testing. Yes, blood pressure is a kidney test in the bigger picture. Because uncontrolled blood pressure can damage kidneys, and kidney disease can worsen blood pressure, home blood pressure monitoring can be very helpful. Use a proper cuff, sit quietly, measure correctly, write down the numbers, bring them to your doctor. Do not rely only on one reading at a pharmacy when you feel stressed. Track patterns. Test number 7. Blood sugar and A1C. Diabetes is one of the leading causes of kidney disease. High blood sugar can damage the tiny filters in the kidneys over time. A1C gives an estimate of average blood sugar over the past few months. If your A1C is high, your kidneys may be at risk. Even prediabetes deserves attention. Do not wait until diabetes is severe. Protect the kidneys early. Test number 8. Kidney ultrasound. Sometimes doctors need to look at the kidneys. An ultrasound can help evaluate kidney size, structure, cysts, blockages, stones, swelling, or other physical problems. It does not replace blood and urine tests, but it can provide important information when labs or symptoms suggest a problem. Test number 9. Nephrologist evaluation and follow-up testing. If your kidney numbers are worsening, if your urine has protein, if your blood pressure is difficult to control, or if the cause is unclear, your doctor may refer you to a nephrologist. A nephrologist is a kidney specialist. They may order repeat labs, imaging, autoimmune tests, medication review, diet guidance, or other tests depending on your situation. The goal is not to scare you. The goal is to get the right person involved early enough. Now let us return to Robert. After his test results, he finally understood that his kidneys had not suddenly become weak overnight. The damage came from years of pressure, high blood pressure, too much sodium, borderline diabetes becoming worse, frequent painkiller use, weight gain, missed follow-ups, ignoring foamy urine, ignoring swelling, ignoring fatigue. Robert was lucky because he still had time to act. His doctor adjusted his blood pressure plan. He got serious about blood sugar. He reduced salt. He stopped taking painkillers casually and asked for safer pain options. He checked his blood pressure at home. He asked about his eGFR and UACR. He walked after meals. He followed up. And most importantly, he stopped saying, "I'm fine," when his body was clearly saying, "Pay attention." That is the message for you. Do not wait for a crisis. Do not wait for dialysis to become part of the conversation. Do not wait until symptoms are severe. Ask for the tests. Know your numbers. Now let me give you extra kidney protection tips. Tip number 1. Control blood pressure. This is one of the most powerful kidney protection habits. Take medication as prescribed. Reduce sodium. Move daily if your doctor allows. Sleep better. Monitor your numbers. Tip number 2. Control blood sugar. If you have diabetes or prediabetes, your kidneys are watching every year. Do not ignore A1C. Do not ignore urine albumin testing. Tip number 3. Be careful with painkillers. Certain over-the-counter pain medicines, especially NSAIDs like ibuprofen or naproxen, can be risky for the kidneys in some people, especially with CKD, dehydration, heart disease, older age, or certain medications. Do not use them casually every day without medical guidance. Tip number 4. Reduce sodium. Too much sodium can worsen blood pressure and swelling. Watch canned soups, processed meats, chips, fast food, frozen meals, salty sauces, and restaurant foods. Tip number 5. Do not smoke. Smoking damages blood vessels, and your kidneys depend on healthy blood vessels. Tip number 6. Stay hydrated appropriately, not too little, not blindly too much. If you have kidney disease or heart failure, ask your doctor how much fluid is right for you. Tip number 7. Do not ignore foamy urine. It may be one of the earliest signs of kidney filter damage. Tip number 8. Ask for both blood and urine tests. Creatinine and eGFR are important, but urine albumin matters too. Tip number 9. Follow up. One test is a snapshot. Repeated testing shows the trend. And trends are what doctors use to understand kidney risk. Now let us close with the most important truth. Kidney failure rarely arrives without warning. The problem is that the warnings are easy to misunderstand. Fatigue looks like age. Swelling looks like salt. Nighttime urination looks like normal aging. Foamy urine looks harmless. Itching looks like dry skin. Poor appetite looks like stomach trouble. Shortness of breath looks like being out of shape. High blood pressure feels like nothing at all. But your body may be speaking. And now you know the language better. If you notice one sign, do not panic. If you notice several signs, especially with diabetes or high blood pressure, do not ignore it. Call your doctor. Ask about kidney testing. Ask for creatinine. Ask for eGFR. Ask for urine albumin to creatinine ratio. Ask for urinalysis. Ask what your blood pressure and A1C mean for your kidneys. Those questions can change your future. This video is for educational and informational purposes only. It is not personal medical advice and does not replace your doctor, nephrologist, pharmacist, or healthcare team. If you have chest pain, severe shortness of breath, confusion, sudden swelling, blood in the urine, very little urination, extremely high blood pressure, or severe weakness, seek medical care promptly. I am Dr. Adrian. Take care of your kidneys. Take care of your numbers. And remember this. The danger is not always that your body stays silent. Sometimes the danger is that your body is speaking, but you do not know what it is saying. Listen early, test early, and protect the kidney function you still have.